In this video, I'll share my 5 favorite household items to reduce knee pain. People with knee pain commonly have swelling, and if you feel like you might have a little bit of swelling in one or both knees, or your knees feel full or tight, I recommend using a flexible tape measure. You would do this with your knees straight, and you would measure right above your kneecap, and again, right below your kneecap. You would record these measurements and then 1 to 2 weeks later, measure them again. This would give you an insight as to whether or not you are reducing your swelling. It's hard to get rid of knee pain if you have some residual swelling, and that's why I've started with the flexible tape measure. When swelling is present, it means there's a thinner, lower quality fluid inside that doesn't lubricate and cushion and protect your knee. A large bath towel folded in half lengthwise and then rolled up is a good size to put underneath your knees for an exercise called quad sets. If this isn't comfortable, some people will benefit from using a second towel roll rolled around the first to provide a little bit more support under their knees. The quad set is an exercise in which you tighten the muscles on the front of your thighs. And the purpose of doing so is to thicken the fluid inside your knees to provide better lubrication and cushion for your knees. And over time, it decreases knee pain and stiffness. Inflating a balloon engages your core muscles, including your transverse abdominis, which wraps around your trunk and supports your back. Having a strong core is important because when you use your hip muscles, it will pull on your trunk. And so a strong core provides a good foundation for your hip. In the case of quad sets, when you're tightening the muscles on the front of your thighs, especially if you're noticing any like rubbing or friction or clicking or a little mild discomfort, I'll oftentimes suggest to clients that they engage their core muscles first. Maintain that contraction, then kind of squeeze both sides of their glutes together, and then perform the tightening of their thigh muscles. You may not need a balloon to tighten your core, but it is a useful item to ensure that you're utilizing the right muscles. There are 2 types of furniture movers or sliders that you can get. One is for carpet and one is for harder surfaces. You put a furniture mover under your foot as you're sitting in a chair. You can slide your foot in and out effortlessly. And that gentle movement spreads around the fluid inside your knee. You may have heard that fluid called synovial fluid or joint fluid. By spreading around that fluid, it provides some lubrication for your knee. When people feel tension in the front of their thighs, their tendency is to stretch. And the most common way they do this is by drawing their heel up toward the back of their hip, and that stretches the front of the thigh. But it also puts a lot of pressure on the knee, and sometimes this causes delayed pain, or pain that's not felt during the stretch but hours later or the next day. To avoid contributing to the knee pain, I recommend applying pressure to the front of the thigh muscles and staying clear of the kneecap, so staying well above the kneecap. By applying this pressure, you can decrease some of the tension while still protecting your knee. I'm using a rolling pin, but if you have a trigger point stick or a foam roll around the house, that is fine to use as well. The pressure should be enough that it might cause a little discomfort, but it doesn't cause pain, doesn't cause you to hold your breath. And those are my 5 favorite household items for knee pain. Thanks for watching.